And who better than to bring on stage here to talk about leveraging first-party and third-party data for patient acquisition than our Director of Analytics, 8-year legend of Cardinal, Alex Kemp, one of my favorite people to work with. And I say every day that the reason I'm still here is because I learn something new every day, and a lot of it comes from Alex. So Alex, we're super excited to have you. I am just here to introduce you. It is your stage. You are the star, and I'll let you go ahead and dive in.
Well, great. Thank you, Lauren. And thank you everyone for attending this morning. So my name is Alex Kemp, and this is 5 ways to leverage first-party and third-party data for patient acquisition. So we're going to talk through some theory today, as well as some practical applications of some real-world scenarios where we apply some of that theory. But with all that said, let's go ahead and get into the agenda to see what we're going to be talking about today. So first off, we're going to just talk about kind of an introduction to first-party and third-party data. What do we mean by first-party and third-party, and kind of how can it play a part in your kind of marketing program? Then we'll get into first-party specifically and go through 3 specific ways of using first-party data to acquire new patients. And then we'll get into third-party data, where we'll cover 2 specific ways of using third-party data to acquire new patients. And then finally, we'll kind of wrap it up with some key takeaways, as well as a Q&A. So we'll have about 5 to 10 minutes there at the end. So if you have any questions as I'm going through this, feel free to ask questions at the end, and I'm happy to answer them. So with that said, before we get into the meat of the presentation, just a bit about me. Like Lauren said, I'm the Senior Director of Analytics here at Cardinal. Just hit 8 years with Cardinal, so been here for a while. Most of my career has been in paid media, and now I'm kind of in more so the analytics department and kind of bringing over some of that knowledge and expertise there. So, but that's kind of enough about me. I do want to kind of get into the bulk of the presentation here. So let's talk about the introduction to first-party and third-party data. So to actually kind of give some definitions to these 2 terms, when we talk about first-party data, really what we're talking about is data that your organization is already collecting and owning, either based off of interactions with your current patients or potential patients. So, any first-party data that you're collecting through marketing or just through your internal operations. And then when we're talking about third-party data, we're talking about data from other sources outside of your own, things like provider data sources, insurers, or market research, as an example. So that's just to kind of define these 2 things that we're going to be talking about a lot today. We are going to be going through 3 specific examples of each to kind of demonstrate how we can use these strategies. So let's go ahead and look at the 3 examples of first-party data that we're going to be walking through. So the first is going to be our CRM data. So that's going to be the actual, the platform that's collecting the marketing data and seeing the outcomes of the leads that you're generating through your marketing campaigns. Then we have call tracking data. So this is going to be the call tracking providers that are tracking your inbound calls, your outbound calls, as well as the actual outcomes of those calls. So was there actually a booked appointment or not? And then finally, operational data. So that's going to be specifically around staff performance in terms of booking leads into appointments, as well as things like unanswered call rates. So that's going to be kind of more about kind of call intake data. And the kind of main thing here with first-party data is that it's kind of your internal gold mine that you're already sitting on top of and likely not leveraging to its fullest extent. So this is a really big opportunity for people who aren't already leveraging first-party data. And then let's talk about the third-party data examples that we'll walk through today. So we'll walk through claims data. So this is specifically insurance claims data around diagnoses, procedures, and medications, as well as just general healthcare utilization patterns. Then we'll get into payer data. So that kind of takes it a step further with the claims data to say, here are the specific audiences and which audiences are covered by which insurance networks. And then finally, the last example we'll cover today is the social determinants of health data. So this is going to be non-medical factors that influence patient outcomes. So we'll kind of define that later and talk about how we can use that. But these are the 3 kind of larger examples we're going to use in terms of third-party data. All right. with all that said, let's go ahead and get into the first way to use first-party data, and that is going to be what I call a roundabout feedback loop. So let me kind of show you what I mean by that. So this is kind of meant to show you in an ideal world, if we had everything that we wanted, we would have a perfect feedback, closed loop feedback system between our ad platforms and our CRMs. So in this case, the ad platform is Google Ads and the CRM is Salesforce, just to use a couple examples, right? So the idea is that in a perfect world, we are sending leads from our ad platform into our CRM. And then our CRM is understanding which of those leads are actually converting and then sending that information back into Google. So you have this, again, this kind of closed loop feedback loop. Now, the issue is that as simple it is to kind of draw it out here in a diagram, it's very hard to achieve for lots of different reasons. So this is kind of what the real world ends up looking like a lot of times is you're sending leads from your ad platform into CRM, but you are not sending it back into the ad platform. So that is due to any number of reasons around being able to capture the click ID. Maybe your CRM just doesn't play nicely with other ad platforms in terms of integration. So this is what we see a lot of the times, and that causes issues with lead quality and improving your ROI. So what I'm kind of proposing is this alternative worldview here, where although it might not be a perfect integration between our CRM and our ad platform, can we at least take some insights that we're seeing in CRM and apply those insights to our campaigns on the front end to help improve the back end? So this is kind of from a conceptual view, kind of what I'm talking about, but let's look at it from a real world example. So this is a real story, real case study where we had a client that was running ads in New York and New Jersey, and in Google, all we were able to measure up to, again, due to those limitations that we just discussed, all that we were able to measure was leads and cost per lead. So this blue box is kind of what Google sees, quote unquote, of, okay, you told me to go get leads, I'm going to get as many leads as I can. And what we were seeing was that Google was spending a lot of budget in New York, where the cost per lead was much lower, $89 versus $154 in New Jersey. But what Google didn't see, and what the CRM did see, though, was that the booking conversion rate on the leads in New Jersey was nearly twice that, or actually more than twice that, of the booking conversion rate in New York. So the CRM was showing like, yes, the cost per lead is good in New York, but the ultimate cost per booking is much higher compared to New Jersey. So what we were able to do here is take these insights and say, okay, even though we're not getting these insights back into Google, we can still see it in the CRM. Let's restructure our campaigns to separate those two states out to their own campaigns, give New Jersey more budget, give New York less budget. And what we expected to see overall was a lower lead volume, which is, that's expected because we're not optimizing towards CPL anymore. But what we did end up seeing was more bookings at a lower cost per booking. So this is just an example of where you can kind of take the insights you're seeing in your CRM and apply those learnings, even if it's not this seamless integration between the CRM and the ad platform. Now, a lot of times when I talk about this, people will ask, like, how is that done? If you're not passing the G-CLID back from Salesforce into Google Ads, how are you doing that? And one of the things that we kind of do here is try to kind of just back to the future mentality of just going back to the basics of using UTM parameters in our URLs. I mean, if you aren't already, you should be, but a lot of times this will do a lot of the hard work in terms of understanding which leads in your CRM are actually converting to new patients. So in this case, this is how we were able to see that actually leads from New Jersey were converting at a much higher rate. So there's still ways you can connect the dots between these two platforms, even if it's not a direct integration. So the idea here is we're kind of not making we're not making perfect the enemy of good. So really we're trying to move down the scale and kind of get closer to perfect rather than just kind of saying, well, we can't integrate it, so let's just call it a day. So this is just one way of using that CRM data. Great. So now let's get into the second way of using first-party data, which is going to be voice of the patient. And specifically what I mean by voice of the patient is looking at things like reasons for non-conversion. So within your call tracking platforms, you're able to see what you can see is like reasons not booked, or basically when the lead was on the phone, what was the reason they did not end up being an appointment, converting to an appointment. And so in this case, we saw an example with client where the number one culprit in terms of reasons not booked was out-of-network insurance. So that was something we wanted to pinpoint and say, okay, how can we take this insight and apply it to our marketing campaigns to drive better outcomes? So what we did was kind of refine our ad copy from a paid search perspective. So we made it more clear, both from a kind of headline and structured snippet perspective, which insurances were covered for our brand. And specifically, you can see that structured snippet there kind of lists out the specific insurances. So that kind of covered the pre-click side. We also wanted to cover the post-click side on the landing page to make sure it's very clear which insurances we cover. So the insurance bar was kind of made more prominent on the page. It was moved up the page. And generally what we saw was fewer calls from people with out-of-network insurance, which led to a higher booking conversion rate and more bookings. So this was one way that we kind of leveraged that voice of the customer data to, again, go back to our marketing campaigns on the front end and make some refinements. Cool. Let's get into the third way of using first-party data, and that is aligning marketing and operations. So you'll hear Cardinal talk a lot about this in general and kind of in our content. But what we're talking about here in this specific case is, let's take some of the operational data that we're seeing in the platforms that we can track or that we're tracking it in. Is there any potentially operational inefficiencies that we can cover where essentially we're helping the new patient acquisition, but we're not helping it from a marketing side, we're not helping it from an operational side. So let me kind of explain what I'm talking about here. So what we're able to do for one of our clients was looking at staff performance in terms of how well were staff converting leads on the phone. And then also what were the reasons why any given lead was not converted by staff member. So each one of these lines here is a given staff member. And what we're able to see is there a disproportionate amount of things like dropped calls or hangups or caller procrastination for any given staff member, which would then again kind of give the client some insight into where can I focus my time and effort in terms of converting these leads. So if I know that a certain staff member is struggling to convert, that is something that I can focus on. And again, this is more so where we're showing the client this information, and then the client is working with their operations to kind of make these adjustments, versus what I talked about so far has been more so on the marketing side. So again, what we were able to show is, let's look at each staff member. What is their booking conversion rate from lead to bookings? And then are there any opportunities to adjust the call center or the staffing for this center to make sure we're converting as many of those leads as possible? So this was another angle we looked at. It was just, what is the total conversion rate by staff member from lead to booking? We also wanted to look at things like unanswered call rate. So this is essentially looking at a heat map of unanswered calls by hour of week. And what we found was that there's kind of a peak time in certain days of the week where we were seeing as high as 9 unanswered calls per hour. And so what we were able to do was inform the client of this, and they were able to make some adjustments in their staffing and in their call center to make sure they were staffed properly during these kind of peak times. And ultimately what we saw, kind of again going through those 3 slides that we just went through, the result of what we saw from all of this was that the average missed calls per day went down from about 1.5 to 2 per day to under half of a call per day. And the total percent of total calls as unanswered went down significantly as well. So that helped. Obviously, more answered calls means more leads, means more bookings. And in general, we also just saw that trickle down to us. So in terms of leads, booked appointments, and booking conversion rate, we saw that improve from about 15% to about 22% in a couple of months, where we saw, the bookings also increase pretty substantially. So this was all kind of the this is the all the result of everything that we did from the call center perspective and the aligning marketing and operations, is to, say, hey, here's we can do everything we can on the marketing side, but also there's ways to move the needle on the operational side here. And that's what we were able to do here with, tracking first party data like this. All right, so let's get into third party data. So closing out first party data, getting into third party, and we're going to be talking about this concept of what I call targeting the needle, which is kind of a call back to the, the needle in the haystack kind of concept of, I think a lot of times we see brands and advertisers target and burn through the entire haystack in order to get to that needle within it. And what we're saying is let's skip the burning of the haystack part and let's just get straight to the needle. So how can we get really precise with our targeting when we're in a sensitive kind of vertical like healthcare? So specifically what I'm talking about here is using claims data to basically find the needle and get in front of that person. So we're going to talk about how you can use claims data to both to plan, activate, and measure your campaigns. So planning in terms of identifying those audiences, activating in terms of actually, activating those audiences in the real world and getting in front of them, and then using claims data to also measure the impact of your campaigns. So let's walk through each one of those separately. So this was an example of a client where we use claims data to plan and kind of assess potentially a market expansion. So the client was already in San Antonio. They wanted to understand what is the relative size of the market in Houston, what is the total addressable market in Houston. So what we were able to understand is that, number one, the Houston market was substantially larger than San Antonio, so just much more potential in terms of total patients. And we were also able to see the total addressable market by understanding of the total patients in that market, how many are already receiving care. And so what we saw was that was less than 10% in Houston. So this was an example we were able to show the client and work with them for this kind of very strategic market expansion opportunity to say, hey, there's actually a lot of opportunity in here in Houston relative to a market that you're already in, like in San Antonio. So this was an example of how we kind of planned using claims data. And then you get into the activate stage. So this is actually when you get to take that audience that you curated and then activate it in the real world and get in front of them in terms of kind of a omni-channel media approach. So this is where you can actually push audiences into various platforms and target them. The other really important piece of this that we didn't cover on that last section was layering on insurances and payer data with the medical information. So with the claims data, we're able to see diagnoses, procedures, medications, but when we actually activate the audience, we'll also be able to layer on people with the right insurance. And by right insurance, I just mean, insurances that you accept. So the intersection of those two kind of circles is where you really find the needle, so to speak, in that very specific audience where you don't have to burn through people with the wrong diagnosis or the wrong insurances. You're getting kind of straight to the point. And then finally, let's talk about measuring campaigns with claims data. So this is going to be where you can actually tie back ad interactions to insurance claims. So you can see, okay, this new insurance claim that I got for my brand had an ad interaction with one of my campaigns. And that's how you're able to see, okay, not only did we get more insurance claims after I launched my campaign, but I can attribute those claims back to campaigns that we launched, not just there were more in general after the campaign launch. It gets very precise in terms of how you can attribute it back. So that's one way of measuring it. The other really cool way is looking at your competitive, your kind of position in the market compared to your competitors. So you can see how insurance claims are fluctuating by competitor and by contribution within the market. So that's a really another kind of cool way of seeing how you stack up against your competitors. All right, and then finally, number 5 here, looking at third-party data. This is going to be precision with context. So we'll kind of talk about what that means, but we talked about using claims data. This is taking it one step further. So this is kind of like the ultimate holy grail of third-party data. So what we talked about so far is using the medical observations and medical history of diagnoses, procedures, and medications to target the right person. This is taking a step further to then contextualize this a bit more with social determinants of health. And so again, this is kind of the holy grail, the next step of taking the claims data to another level. So what we mean by social determinants of health are going to be, again, non-medical factors that influence someone's health outcomes or basically access to healthcare. So these are going to be things like education, neighborhood, economic stability, things like this. These are all things recognized by the CDC as social determinants of health. And the way this kind of comes into play from a marketing perspective is, number one, you're kind of enriching your patient profile. First of all, we looked at the claims data, and you're targeting the people with the right audience and the right insurance, with the right diagnosis and the right insurance. But now you're also contextualizing this and enriching that profile with kind of more qualitative factors that you didn't know before. So, again, the specific barriers that they're facing, and the way that kind of ties into your marketing is through your messaging primarily, right? So if we can understand, if we layer on the social determinants of health along with the right diagnosis and the right insurance, we can understand what socioeconomic and kind of cultural barriers there are for patients, and then acknowledge and address those challenges in our messaging, both from an ad copy and landing page perspective. So again, this is kind of taking it one step further, using some context to your preciseness with how you're targeting your audience and speaking to them kind of more directly. So to kind of close us out here, some key takeaways, and we'll go through the Q&A. The first one is just integrating first-party and third-party data for better targeting. So again, first-party data is going to be that kind of internal gold mine that you're already sitting on top of, that you're likely not using to its fullest extent. So make sure you're checking that box for sure, and then using third-party data to kind of take it a step further and getting in front of the right audience. Bridge the data gap without perfect integration. So this is kind of referring back to that roundabout feedback loop. Let's not make perfect the enemy of good, and let's try to connect the dots as much as we can between those two platforms, even if we can't have a direct integration. And then finally, leverage claims data and social determinants of health to enhance precision. So this is really where you can stop targeting the haystack, start targeting the needle, and also speak to that person in a more kind of cognizant or be more cognizant in the way that you're speaking to that person when you're tying back the social determinants of health. So those are the 3 takeaways. I appreciate everyone's time and attending. I know we're a little bit tight on time, but I think we do have some time for a few questions. Okay. Yeah, so where's the best source to get claims data? There's a few different platforms that you can leverage. There's Purple Lab is one. Definitive Healthcare is another one that's pretty popular. And there's a few other ones that I'm not remembering right now, but those are some of the most popular ones, some of the ones that we leverage here at Cardinal. And I'm trying to read through as much as I can. I know we're at 11:30, but I'm also happy to. Purple Lab was the first one. I'm also happy to answer any questions. Again, we have that kind of QR code that you can go to, but happy to answer any questions after the fact. And thank you everyone for attending.